بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. One more time, dear community members, welcome to our weekly broadcasting here at the Prayer Center in Orland Park. Today is Monday, March the 8th of 2021, and we are here to talk about the new guidelines for the vaccine and the COVID-19 virus and the preparation that we need to take for the coming Ramadan, which is just a few weeks away from us, inshallah ta'ala. We are honored to have two distinguished guest speakers who will be talking to us, inshallah ta'ala, about these two important topics that we chose for us tonight. I would like to welcome both of them, Dr. Kamal Ad-Dirawi, who is an associate professor at the University of Illinois here in Chicago. Also, he is leading the task force on behalf of the Council of Islamic Organizations in Greater Chicago. And he has been a real resource for all the Muslim organizations and webinars and training and all the updates that we need. And Jazahullahu anna kulla khair. We also have with us Dr. Yazan Judah, who is a community member, a physician in our community, who is specialized as a primary care, also internal medicine and obesity. Welcome to both of you. أهلا وسهلا فيكم دكتور كمال ودكتور يزن.
أهلا بكم.
أهلا بك.
حياكم الله. So before we start, as usual, I'm going to ask everyone to go to their Facebook page and try to share the streaming so we can benefit from that, inshallah ta'ala, because what we want to do is to make sure that everyone benefits, inshallah. Let me do that myself, and then we'll start the session. So give me just 1 second and share public now. We are already live. طيب, let me start with Dr. Kamal Ad-Dirawi. What are we at now? Today we heard that the CDC gave some update that fully vaccinated people can share an indoor room with each other without the masks on, without the 6 feet. What else do we know? If there are people who are not vaccinated yet, can they still share with them the same room? What other details has came from the CDC update, inshallah?
السلام عليكم ورحمة الله وبركاته. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. جزاكم الله خير, Sheikh Kifah, for hosting us and for leading the community during these challenging and difficult times. As you probably know, and I'm sure everybody is watching the news and trying to get some hope from what's happening. Alhamdulillah, we are seeing the light at the end of the tunnel with the number of infected, number of deaths dropping in the United States, in Illinois, and in many parts of the world as well. And now with the increased uptake of the vaccine or the vaccines, now we have 3 vaccines. We have Pfizer and Moderna, and recently we had Johnson & Johnson. Alhamdulillah, we have more people getting vaccinated as we speak. The number, as far as I checked, as far as I know, today or yesterday was around 90 million. And in Illinois, we have over 1 million have been fully vaccinated, around 9% of the state's population. Very good news, but we still have a long way to go. Now, today the CDC has announced new guidelines for fully vaccinated. Let me first define what they mean by fully vaccinated. Fully vaccinated, with regards to Pfizer and Moderna, they have to have taken the 2 doses, and then you become fully vaccinated 14 days from the second dose.
After 14 days.
After 14 days from the second dose. Now with Johnson & Johnson, you are, because it's 1 shot, 1 dose, so you are 14 days after the only and the first dose, basically the only dose. So basically that's what they mean by fully vaccinated. Now, what they have said, fully vaccinated people can gather indoors with fully vaccinated people without wearing a mask. They did not mention the social distancing and the most recent guidelines, but it's a given that maybe they will be closer to each other because they are indoors and they are together. Now,
Okay.
you can gather indoors with unvaccinated people from one other household, for example, visiting, like Sheikh Kifah, I know you got your first dose. Once you get the second dose, 14 days afterward, you want to visit your daughter, your son who lives in another household, there who are living separately. You can go and visit them without a mask unless any of those that you are visiting who are not fully vaccinated at an increased risk for severe illness for
No.
COVID-19. And
So if they are of high risk, then you should watch that.
exactly, and high risk means they have an underlying conditions like cancer, like diabetes, like obesity, like pregnancy, Down syndrome, and so forth. So the list we already know. So you can visit, but still you want to be careful if some of them or one of them is at increased risk. You cannot let your guards down. The reason for that, maybe
I'm going to hold you here because there's a lot of information. We're going to come back to you, Dr. Kamal. Let me go back to Dr. Yazan. We know now there is Moderna, Pfizer, and Johnson & Johnson. What is the difference? Because, when I went to take my own vaccine, they had choices. There was only available Moderna and Pfizer. When I went, I didn't have a choice. They said, we have Pfizer today. I said, Pfizer is Pfizer. But let us say these places, of taking the vaccination have the three, and do you get to choose? And based on what? Should I be concerned if I have allergies? Would there be any medical choices as a physician? Would you say what's the preference and what's more preferable age-wise, illness-wise? Is there anything like that as preferences?
Okay. Assalamu alaikum. Again, jazakumullah khairan for the invitation. So the first answer is that if you have a chance to get the vaccine, we don't select which one you prefer. And in my own clinic, for my own staff members, as well as my own family members who have gotten the vaccine, so far, half of us got Pfizer, half of us got Moderna. It's good that we have multiple companies coming up with a vaccine because, as everyone is aware, we don't even have enough vaccines so far to vaccinate everyone. So we need more companies to give more access. But the basic difference is that each company is using a slightly different technique to help create an immune response to the COVID-19 vaccine. One thing that I want to make clear, because there's a lot of misconceptions about the COVID vaccine, is that there is no vaccine that is giving you the live virus. Some people think because of the flu vaccine, there are some flu vaccines that are a live virus, and even the main flu vaccine is an inactivated virus, so it's like a killed virus. But this is not giving you the virus whatsoever. It's not inactivated. You're not getting a partial component. What it's giving is some genetic blueprint so that our body can create what's called the spike protein. It's a unique structure to the COVID-19 virus. So by putting in this DNA or RNA, depending on which company, it is allowing our body to create something to make our body recognize the COVID-19 virus. And then we are able to develop an immune response. So the Pfizer and Moderna use RNA technology to create this response to the spike protein, while the Johnson & Johnson vaccine uses a DNA vector. But the bottom line is none of these are the actual virus. It's just a blueprint for the virus. And as far as the efficacy, and we can go more into this a little bit later probably, they're all very highly effective at preventing severe illness and hospitalization and death from COVID-19. So at this point, if you have the opportunity to get the vaccine, you should never walk away because you thought you were getting, for example, Pfizer, but they only offered Moderna. All of them are considered highly effective. And as was mentioned, we only still have just about 9% in Illinois. we still have a long way to go. And in order for us to get to a better...
Let me go to Dr. Kamal for this particular area. Dr. Kamal, you mentioned that we are now 90 million, nationwide, 1 million in the state of Illinois. That's still a low number in the state of Illinois itself compared to the whole public. Do you think now, let's talk a little bit politics because it is kind of involved, having Biden administration now, in charge versus local state, governors who are over, seeing the logistics for that matter. Is this still, we are having a problem, especially I want to relate it to Ramadan. So in your own statistics, with your own relationship with the city of Chicago, from now till Ramadan, we are now in what, phase 1B plus? The general public, do you have a roadmap of when would we be able to get vaccinated for the public before Ramadan, you think?
As far as the entire public, I'm not sure that will happen. Remember, we are talking about 1 month, but I think we will have a significant increase in the number of people who are vaccinated. Now, with the latest phase that was launched on the 25th of February, basically allowing those with underlying conditions between the ages of 16 or 18 and 65 to get vaccinated, we are talking about an additional 3 million. So 3 million in addition to the million that who have been vaccinated, I think we'll have a significant number of people vaccinated before or by Ramadan. And I'm thinking now not only with political change in the country, but also with the third company, with the third vaccine being approved in the United States. I'm hoping and I'm expecting a significant increase in the number of available vaccinations and the number of people who can be vaccinated. You remember, it's not only the number of doses, the number of vaccines we have, and the amount of vaccines we have. It's also the logistics, which is really, there are a lot of challenges, but I know everybody is gearing up for more availability of the vaccines, so we are more ready to vaccinate a larger number of people in a relatively shorter period of time.
What about hospital, ability to respond? Are we now seeing less number of deaths versus more number of COVID, because there was a spike of cases up back, a couple months ago. But then when you first introduced, the few words you said, we are seeing it down, going down. Are we going down in number of cases, or are we going down in number of deaths as far as how many people are dying out of that?
In Illinois, we are seeing less hospitalizations, and we are, and alhamdulillah, we are seeing less death definitely, and we are seeing less cases. Now, again, when we say less, it's less what we had a few months ago, but still not far from what we had, let's say, in May or June of last year. So it's still, we are not completely out of the woods as we speak.
I see.
And the one thing I want to also highlight is basically, for example, as of yesterday, if my statistics, yes, as of let's say as recent as I have here, which is late February, early March, we have around over 2,000 people in Illinois still hospitalized. We have 265 people on ventilators. We have 513 in ICUs. So it's still a significant.
That is in the state of Illinois.
In the state of Illinois, yeah.
Dr. Riaza, let me go back to you. Vaccination, we took the vaccine, 2 doses, 14 days. How long this immunity system is going to work in? And is it something like, when we go to Hajj every year, they tell you have to take the meningitis, the flu shot, people take it every year. Are we going to be in this shoe, like every year is going to come back? And another question also, if you want to elaborate on the new strains that were, in West Africa, another strain coming, and something from Brazil lately. We heard about, some case came to Chicago. So in these 2 points, your thoughts on that, please.
Sure. So the first point is, of course, being that this is a new virus and a new vaccine, situation, we don't have the exact data, only time will tell. But as of now, because research started approximately 1 year ago, it looks promising that the vaccine likely works for at least 9 months and probably at least a year to up to a year. I think by the end of the summer, we'll have more data on the efficacy because of those early vaccinated people on whether the immunity lasts longer than that. So we will know, over the next 12 months if it's going to be an annual thing. As far as these different strains and variants, so the first part is that it looks like the safest thing is that we're probably going to hear that even after 1 year, we might need a booster, whether it's a booster just to deal with COVID-19 in general, or a booster to deal with the extra variations of COVID-19. That is one of the reasons when my patients ask me about the COVID-19 vaccine, I tell them the longer we wait as a society to get vaccinated, the longer we take to get the herd immunity, then the more we're going to be dealing with this frustrating problem, and the more we're going to have to get multiple vaccines just to have some semblance of life. So that's why I urge the community, I urge my patients, I urge family members to get the vaccine as soon as you are able to, because that's the only way we're going to be able to bring these numbers down and prevent the emergence of all these new strains. Now, as far as current data, there's ongoing research on the vaccines that are already out there on whether they tackle some of these variants. And suffice it to say that it seems like some vaccines already have some preliminary data demonstrating efficacy at some of the strains, and some of the vaccines so far look like that they're not as effective against certain strains. So again, we might get more evidence in the future that suggests certain vaccines might be more preferable in certain communities. But for now, all we can say is that the vaccine does cover the overwhelming majority of the problem of COVID-19. So we have to take what we have available. But again, the fear is that the longer we wait to reach herd immunity, then we are going to be dealing with more problems.
طيب. Dr. Kamal, I have here a sheet in front of me that you prepared and presented in one of the webinars that we did with the CIGC, that you were saying the current Illinois guidelines in Illinois, places of worship no more than 10 recommended, but if adherence to this capacity is difficult, set a capacity limit that allows for social distancing of 6 feet, multiple shorter prayers, remote services, apply safety protocols, offer outdoor options. And people complain. And you go to any restaurant now, I mean, in Bridgeview or in Orland Park or in any Burridge, I mean, you go to these restaurants and they are packed like bees. You go to weddings, even banquets now. I'm seeing on Facebook, Allah yfarrih al-jamia, may everyone be happy, whatever. But what happened to the 50 people who, we are seeing in hundreds of people and mixing and mingling? Oh, I don't know. Has the guidelines changed, or where are we at in this now?
The guidelines for gatherings and for events is 50%, 50 people or 50% capacity, while maintaining and adhering to these social distancing guidelines, wearing a mask, and so forth. We need to really think about where these guidelines come from. The governor is under a lot of pressure to open up. Now, they started by issuing guidelines for places of worship. Then there were some lawsuits and courts and so forth. And they basically now their guidelines basically recommendations, and initially it was 10 people, and then things got relaxed a bit. But the issue is here, when you eat at a restaurant is different than eating at home. What I mean by that is a restaurant is a business, and there's a lot of pressure from the business community to open restaurants so people can continue to have their livelihood. So now if people decide not to adhere to those guidelines, it's basically it's their decision. However, we have an obligation to protect our community, especially at our masajid. When you eat at a masjid, that's something. A masjid is not a business. It's a place for worship. We know this is difficult. This is hard. There might be some ways to accommodate some of this, breaking fast rituals we have, in Ramadan, like some tamar, some water. If masajid, for example, can have some stations outside, prepackaged, water and some tamar. So basically, there's no exchange of utensils. There's no exchange of items. So to minimize the transmission of the virus. So we want to make sure we continue to adhere to these guidelines. Again, it has been a very challenging and tough year for everybody.
No, I want to focus on one point before I go back to Dr. Yazan.
Yeah.
If people are going back into normal life, restaurants, banquets, shopping places, but you're saying, okay, the numbers are going down, and so how do you explain that, we're back mixing, but still the numbers are going down? Shouldn't be going up?
I hope not. Remember, there is.
We all hope not. I'm just talking about logic.
Where we have more people vaccinated, and initially also we had a significant number of people who had the condition itself. But let's pray that we are not gonna see another wave, which some experts seem to be cautioning us from. You know what I mean? So if we really let our guards down sooner than when we should do that, there is the risk of having another resurgence. Is it gonna be as high as what we had before? Hopefully not. But it takes some time for waves to develop. And
I want to go back to Dr. Yazan. We're talking about vaccines, immunity 9 months, 1 year. What about the numbers that Dr. Kamal mentioned? We still have, I don't know how many cases, 20,000 just in the state of Illinois. How are we treating people with COVID? If the vaccine is for the healthy one to take it so they would be immune in the future, has there been any breakthrough in medicine to provide direct, care for those who are infected with the COVID to either limit the symptoms of the virus, or has it been still whatever we heard about when it first started, ventilators, normal, medicine that were given? Any thoughts on that?
So let's say for the majority of patients who get COVID, it's usually a bad flu-like syndrome, especially with younger patients. The most I see on the outpatient basis is a very bad case of bronchitis and fatigue. And in general, for those cases, usually we just treat with possibly steroids and an inhaler to help open up the airways and relax the breathing. Antibiotics are generally not indicated unless you have a severe case where you think the patient might have a secondary infection, a secondary bacterial infection. So most of the time, the treatment is still just bed rest, anti-inflammatory, staying at home, and keeping away from everyone else. Social distancing and quarantine, of course. But for those severe cases that enter into the hospital, again, it's usually more supportive care, possible oxygenation, bronchodilator support, where they give an inhaler or treatments. And they don't jump to put someone on a ventilator, because if somebody has to get to the point of getting on a ventilator, then that usually means the prognosis is more dismal. And then now there are some more specific guidelines for somebody who has a more severe case to get things like the medicine remdesivir that was approved, that has been shown to help decrease the duration of hospital stay. Some of the things that came out in the very beginning of the pandemic, like the hydroxychloroquine that's used for things like lupus, that did not pan out whatsoever. And other cocktails that were looked at, many studies did not show efficacy. And many research is being done, even regarding like convalescent transfusion, getting, the blood, the serum of someone who's already had COVID, and to see if you can transfuse the antibodies and give someone some of that immunity benefit. That only seems to be beneficial in certain select populations. So lots of research still being done. The main thing, frankly, going back to the subject of this conversation, is to try to get vaccinated and get herd immunity so we don't get COVID. because right now we don't really have direct good treatments for it.
طيب. Dr. Kamal, I want to go more on the Islamic institutions, CIOGC guidelines that they did adopt the CDC guidelines for, recommendations. But with your communication, I've been with you in some of these webinars, the masajid, are they adhering to these guidelines that were set by the CIUGC and from now till Ramadan? Now, at the prayer center, just to take it as an example, we have seen a drop in the number of sisters, particularly coming for Salat al-Jumu'ah. Usually we would have the, first floor like packed with sisters in Salat al-Jumu'ah. Now we are down to 15, 20 sisters max. We have a room for them available. But we're expecting that the sisters will come, especially for the month of Ramadan, for the spirituality that they need. And we urge people at the prayer center, we're going to open the door for the sisters, inshallah, to join us in Ramadan Taraweeh. We'll talk about this in details more when we get closer to Ramadan. But from now till beginning of Ramadan, some of these guidelines change. Instead of 6 feet, can we make it 4 feet, social distancing? Instead of, like we had, don't use the washrooms in the masjid. So it will not, I know they used to say, the virus moves, because can we open that, عادي, normal, no restrictions? And any masajid are adhering to these guidelines. So it's 2 questions.
Now, so far, the guidelines we have issued earlier, basically, alhamdulillah, we provided guidelines at the beginning of the pandemic until the reopening. And the current recommendations and guidelines include, wearing the masks, social distancing or physical distances of 6 feet or more, and continuing to wash your hands, and if you are sick and if you have symptoms, basically if you have been exposed to COVID-19, you avoid the masajid. To the best of my knowledge, these guidelines have been followed and continue to be followed at our masajid. I'm so proud of our community. Since day one, we really said we don't want our masajid to be hotspots of the spread of this virus. And alhamdulillah, I think our masajid, our community, basically has been adhering, has shown how mature and responsible they are, and they care and they want to protect not only the Muslim community but the communities around us as well. So as far as easing these guidelines in light of this update we received today about the fully vaccinated, I don't know if how many people are fully vaccinated in a given masjid. Maybe some of those, if we
I did ask actually in Salat al-Jumu'ah to raise hands how many people took the vaccines. Actually, not more than 10%, I would say.
10%. So comes Ramadan, hopefully that will reach to 30-40%. Maybe we can be creative in how we can ease up a little bit. For example, having the front hall or the back hall for those fully vaccinated, and maybe ease a bit the restrictions there. You know what I mean? And that basically, hopefully, free some space for others. But as of now, we want to continue to follow the guidelines, the 6 feet distance, the masking up, continuing to wash our hands and so forth. Hopefully, things seem to be evolving fast and things are moving in the right direction. I'm really hopeful, within the next month or so, we will have more relaxation of some of these restrictions, and we'll keep you updated as soon as we have news. We really want to share with the community as with what we have been doing so far.
Okay, Dr. Yes, and my question to you is, it has been confusing for a lot of people to understand. Why would one member of the family get the COVID and he's living with his family, everything normal, while his wife doesn't have it or his kids doesn't have it? And they're saying all kind of, misconceptions of, oh, this is like, a planned ومش عارف إيش. But has there been any statistics of, is it some bodies are more vulnerable than others, or is it just because someone might have, like, one of the illnesses like cancer or blood pressure or diabetes, they are, probably more. But we're seeing, حتى young, adults, 20s. And so has there been any medical studies, statistics that you can update us on? How is this one spreading and on what platform?
Okay, so I think I'll make up a couple points here. The short answer is there is no direct, simple explanation of why one person might get it and then other people's. But I would just say this again, as someone working in primary care and who treats entire families, that's just the nature of infections. You have the mother who brings her child in with strep throat, and the mom is very close contact with her child and kisses the child, and yet she doesn't have a strep throat. Or the mom brings the child in with influenza, and sometimes the parents will have influenza and sometimes not. So it's just the nature of the particles. If a kid is or if a person is infected and they're sneezing, so even if you're in close contact, but just because you're in close contact, you just might not have had any nasal particles, aerosolize and land on you or that you breathed in. So that's one simple explanation. Now, while of course COVID can hit anyone, I do have to just make a general comment and warning that it does seem to, as we know, it attacks people with chronic conditions more so than those without chronic conditions. And some of the things that it seems to be associated with are, the things besides things like cancer, tobacco abuse. So things that go with tobacco abuse, and that includes argilla, COPD, recurrent bronchitis. In the pandemic, we're having to social distance and quarantine and stay inside and not do sports much. There's been a rise in obesity and worsening of diabetes, and these are fundamental conditions that have been linked with a greater increased risk for COVID and a greater increased risk for succumbing to COVID. And some of the statistics that came out has showed that in a British study, having diabetes was 3 times as likely to increase mortality. Another study showed that those with diabetes have a 2 times increased risk of having mortality from COVID. And lastly, just the other day in America, many social media and news outlets were reporting studies suggesting that those countries in which the majority of patients suffer from either overweight or obesity have the highest death toll from COVID, over 10-fold increased risk. So this is just a reminder that there are some things that we can do besides the social distancing, the hand washing, the hygiene, that we have to take care of our lifestyles, because it does seem that certain lifestyle factors do affect our risk for developing COVID and then suffering from COVID.
I see. Dr. Kamal, today, March 8th, is the day that the governor of Texas declared that we are going to be an open state, no mask, no social distancing, خلاص, go back to business. Why not Illinois? I mean, why is it what's good for them is not good for us? On what statistics they have came up with such a huge, I think Texas is the largest state in the U.S. I think, geographically. I'm not sure about, population. So what's up?
I'm not going to get into politics, Sheikh Kifah. How decisions are made. Since the beginning of this pandemic, we have been using evidence-based guidelines that have been developed, advocated, or recommended by scientists and by public health officials, and this is what we will continue to do. As of now, we are still not out of the woods. We see a light at the end of the tunnel, and alhamdulillah, things seem to be moving in the right direction. Any rush to relaxing or not adhering to these guidelines or letting our guards down, any rush to that most likely will lead to more resurgences. And as the Dr. Yazan said, those variants, the virus needs to spread and to replicate for variants to evolve and to develop. So the faster we get vaccinated and we control this pandemic, the less likely.
I mean, if more states are gonna start doing like what Texas had done, are we gonna go back in the state of Illinois saying, okay, anyone who travels outside Illinois and come back, he has to quarantine for 14 days? Is this something that might be back on the table?
I wouldn't be surprised because, I think we are into this. We have gone through things have evolved over time in part because of these different restrictions and rules in different states. So you have shelter in place in one state, but you can still travel to another state. People can still go back to your state. And I think this is probably why we have been into this for a long time, to be honest with you. And if we start going back how we started, that's not good news. And my concern is we will start seeing more restrictions, because if people start traveling to those states and bring back the virus or the variants, then we will not be in a good position.
طيب Dr. Yazan, let me ask you, most likely going into Ramadan, the public, as Dr. Kamal has mentioned in the beginning, might not be all ready to be vaccinated. We are still going slow on that. But let us say the essential workers, all these categories that now they can get the vaccine. Out of the symptoms that you have witnessed or that they have been, said it is going to be from severe symptoms as, an outcome of the vaccine. How would that affect on someone's decision to break his or her fast during Ramadan if they had to take the vaccine? Now, first, as a fatwa, we're going to tell people, because this has been studied, your vaccine shot will not break your fast. But what about the symptoms that might be out of that vaccine? Some people reported something, for example, about, stomach ache. I don't know. What kind of symptoms come out from this vaccination? And would that be into a severe case that they might need to break their fast?
Okay, so very good question. In general, it's the similar idea of any illness that you might see the doctor for. Again, just like in the past, whether it's the flu virus, another virus, or you have a migraine headache. So basically, if I was seeing a patient in the office where they call me and they were having any kind of physical ailment, it's a matter of how much can you tolerate it without having to resort to medication. If it got to a point where you had to take medicine, then of course you break your fast and then you make it up. So the more common things that you might see with the vaccine for any of them could be fever, could be body aches, could be headache. Then those are the most common symptoms. And I myself, after the second vaccine, I got a migraine headache for one night. And then the next morning I was fine. I slept it off. The migraine started at nighttime. So many people who have a migraine headache cannot sleep it off. They absolutely have to take medication to get rid of the symptoms, or else the pain will just intensify. So if you had to take something to treat the symptom, then you break your fast. Simple as that. If you had a fever and you felt like you were having fever and chills and you really need to take an anti-inflammatory, again, the simple rules of any illness. If you had to take medication, or if you just felt so sick that you did not necessarily want to take medication, but you just felt that you had to break your fast to eat for energy, obviously we know the rules regarding breaking the fast for illness, and you just make up the fast. But otherwise, I want to emphasize that for all the people that have gotten the vaccine, many people will have very mild symptoms or no symptoms, and will be fine. Otherwise, what you might hear about more often is that if somebody does have symptoms, it's usually after the second one, when your immune system is just primed up more than the first time.
Back to you, Dr. Kamal. Again, from the slides that I have seen you presenting on, with the phase 1B and then phase 1B plus, which includes first responders, educational, teachers, food and agriculture processing. That's 1B. But effective on February 25th, phase 1B plus, which was launched, 16-year-old plus with disabilities or underlying conditions. List of eligible conditions include cancer, chronic kidney disease, chronic obstructive pulmonary diabetes, etc. What is the next phase you think is going to come time-wise? And is the CIUGC planning to do sites for vaccination among masajid or places of Muslim institutions that we can direct people to go to?
Yeah, I can start with with the first question. It's basically, as far as the time, I don't think anybody has the time. When would they will move to the next phase, which is more of the general public who don't have underlying conditions or not in the categories listed earlier. But as far as what CIUGC is doing, CIUGC has been engaged in a serious effort trying to increase vaccination of our community, whether through partnering with organizations that are already providing the vaccine, or through creating creating what we call them points of distribution, basically making our masajid where people can come to get vaccinated, having our centers basically identified as providers for that vaccine. So we're making efforts on the two fronts, and we're making some progress. We're starting with MCC as a pilot site. Hopefully, in the next few weeks, we'll see that materializing, and then we'll start moving to other masajid and other centers. We have, several organizations expressing interest in becoming points of distributions. Our goal is to have our community vaccinated, and we realize there's some hesitancy, but we want to make sure we bring the vaccine to our organizations provided by volunteers who look like us, who identify with our community, hopefully to minimize some of the hesitancy and having more people getting vaccinated. Also, we want to make it easier on our community so they don't go travel far to get the vaccine.
Yeah.
So keep us in your prayers, and we'll continue, inshallah, to
Dr. Yazan, I have 3 minutes left. A quick answer: the difference between a PCR test and an antibody test, and when do people feel that they need to go get a test?
The PCR test is when you're really suspecting an actual acute COVID infection, or you have to rule it out. So that's actually measuring evidence of the actual virus in you or in the nasopharynx. As far as the antibody test, there's different versions, but basically that's to see if there's any sign of either immunity to it or possible past exposure. So that's often done through a blood test. And sometimes we do that to see if it suggests that someone who knows they've had COVID, if it still shows that they have some evidence of immunity. Or sometimes you have a patient who had some vague symptoms that might be suspicious for COVID. They never went and saw a physician or a clinic about it. And then months later, they might be wanting to, to get a test to kind of get a curious idea of if they might have had it. But it's not definitive of that being COVID or not.
I see. Dr. Kamal, one last question for you. Do the public need to just follow up with their masajid for updates, or are you providing other venues of information that they can get through the task force of CIUGC?
We will continue to provide guidance as much as we can, but we send our guidance to the masajid, and then I think doing both ways would be very important to make sure you have the information. And I want to emphasize one thing, a few things here is basically, yes, we have the number of deaths down, the number of cases down, but still we are talking with a serious disease. If you get it, God forbids, and you end up in a hospital, you're going to be in isolation. And those who go through the process, we know some of our community members who have been through it. It's really, it's devastating. And some of them made it, some of them did not make it. So we don't want to let our guards down. Now, those who are vaccinated, there is active research on whether they can transmit the virus or not. but as of now, we don't know. So they might transmit the virus. So if you are vaccinated, that's not you still have an obligation to protect people around you. If you're vaccinated, your wife is not, your parents are not. You want to make sure you don't bring the virus, because so far the vaccine protects or prevents either serious prevents clinical disease. You might be carrying the virus and transmitting around even after getting vaccinated. So we want to make sure you don't transmit the virus to others. If you have symptoms, if you suspect having COVID-19, get tested right away, and do not wait until you are so sick before you go and seek medical care. We don't want you to go to the hospital when you are when it's too severe. Then you know, we don't want you to wait. So please.
So even if you are vaccinated, you could still be a carrier and you can harm others without even you knowing. So pay attention to that.
Yeah.
Dr. Kamal, it has been a pleasure to have you with me here tonight. Dr. Yazan, also, it is an honor to have you both. Jazakumullah khair both for joining us for this 45 minutes. Dear community members, Jazakumullah khair for being with us in this session here tonight. May Allah protect us all. May Allah prevent us from all the sickness. We want to make dua for all those who are in bed or who are in hospitals or who are ill and sick. ربنا يشافيهم ويعافيهم. اللهم رب البأس أذهب البأس واشف أنت الشافي لا شفاء إلا شفاؤك شفاء لا يغادر سقما. And for all those whom we lost and they died because of COVID or any other illness, ربنا يرحمهم ويشافيهم ويحسن إليهم ويرحمهم ويتقبلهم في الصالحين. On behalf of the prayer center, this is your brother Imam Kifah Mustafa. I want to thank my guests. I want to thank the community member who followed us in this broadcasting. We will see you next week, inshallah. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Jazakallah khair. Thank you.